So continue on with my IV demonstrations. We are going to go from a continuous IV to an intermittent with our patient, Miss IV needed. So I'm going to go into the patient's room, perform hand hygiene. I'm going to do some patient identifiers. Hi, Mrs. Needed, can you give me your name and birthday and scan your bracelet? Okay, so IV, we are going to discontinue your continuous flow of IV. We're going to leave the IV in. We're going to use it to be able to give you meds as for the rest of your stay here. We need to discontinue this after your last dose of Clariform, which we have done and given, and now that is discontinued. So what I'm going to do first, again, is perform hand hygiene. I am going to assess the site. Everything looks good. We are going to clamp the tubing. I'm going to clamp the tubing. Okay, tubing is clamped. And I'm going to go ahead and remove the tubing. Actually, I should put that first, but I did. I dispose of that. Perform hand hygiene. Put on my gloves. I'm going to use an alcohol swab to clean this site. So Ivy, this purple lock is going to be in place to keep the blood from coming out while your IV is in place, and then we can use it to access you for meds if needed. Do you have any questions for me? Okay. Alright, I'm going to slowly flush 5. Make sure that the line is still good. There's no infiltration, no redness. The patient is not having any effect and it is not painful. Okay. Line is good. I'm going to get rid of this. I've taught her about maintaining the lock. I'm going to go ahead and return to the MAR and document that we took that tubing out. Line was flushed, no issues there. I'm going to head back in next to Ivy. It's more hand hygiene. And Ivy, we're going to give you some Dilaudid for the pain for your cough. So what I'm going to do next is draw up my medication. I have a 3 milliliter 20 gauge needle. Going to take the cap off. Drop there. So we are giving 2 milligrams. Actually, I'm going to stop there and I'm going to double confirm in the MAR. Okay, so I am going to be giving Miss Ivy Needed, and I have identified patient. 2 patient identifiers. We're going to be giving 2 milligrams IV. IVSP every 2 hours is needed for complaint of pain due to cough. So we're going to take 2 milligrams per milliliter and dilute with 2 milliliters of normal saline. So what I'm going to give right now is we're going to pull 1 milligram. We're going to give 1 milligram every 2 minutes. So I'm going to pull 1 milligram of my Dilaudid, and I am going to add my saline to that. And I'm going to grab that out of the supply. Okay, I'm going to get my medication drawn up. Clean the top of my Dilaudid and perform hand hygiene before that. Alright, now I'm going to pull back my 1 milligram Dilaudid. And I'm going to confirm with another nurse. And then I'm going to pull up clean the top of this vial. And pull up my 2 milliliters of saline for 1 to 2. And go ahead and recap and have a second nurse confirm that, which it was confirmed. Go ahead and get the patient ready. Again, I'm going to assess her site before I give any medication, and it looks good. So I'm going to flush for 5 cc's of saline before giving the med again. Clean the top. Make sure we have a clear, good line. Okay, Ivy, we're going to go ahead and give this Dilaudid. I'm going to push 1 milligram, or 3 milliliters, but it is 1 milligram every 2 minutes. Go ahead and take that needle off. I'm going to clean the top of this. And a new alcohol for there. Make sure we have no air. And then this will be pushed continuously, slowly over 2 minutes to ensure that not too much of the med gets in too fast. For the sake of the video, we are going to determine that that's been pushed slowly over 2 minutes. Once that med is given, we're going to flush with 5 more. That goes in my Sharps container. And I again am going to clean with an alcohol swab and slowly assessing the patient the whole time for any adverse reaction, any infiltration site, any redness, any pain. Ivy has noted there's none, and I can see none. Slowly push the 5 cc's to flush. And no problems at the IV site. Alright, and I'm going to leave patient, and I'm comfortable with Carl Light. I'm going to be back to check on. I'm going to go document at this time in my MAR. So in my MAR, I am documenting that we pushed over 2 minutes, 2 milligrams diluted in 2 milliliters of Dilaudid. No infusion site reaction, patient's reaction, and the time, the date, and we are now going to go ahead and go back to the room as our patient's IV line is going to be discontinued. I'm going to enter back into the patient's room. I'm going to perform some hand hygiene. I'm going to don on some clean gloves. I'm going to start by loosening the tape and not removing the catheter. And my Miss Ivy banana might be a little Again, I'm checking for any redness, any swelling, any pain noted by the patient. None noted at this time. Once all the tape has been removed, I am going to get my gauze ready. And I'm going to slide this out, being ready to apply pressure. In my sharps container. And I'm going to hold pressure for approximately 2 minutes. Checking with my patient who's doing well. He's ready to go home. After that has been, I'm checking for any signs of infection, tenderness, and I'm going to cover the site with a sterile dressing. We're running out of supplies here. And go ahead and return to the MAR, and I'm going to document all that I have done. And Ivy is going to be on her way home. To return to the MAR, I'm going to document that IV was taken out, no reactions, no redness at the site, patient doing well, patient ready to be discharged.